The recent epidemic of the Ebola virus, which hit hard Guinea, Sierra Leone and Liberia, killing more than 11,000 people, revealed many failures in risk communication in West Africa and specified communication, dissemination of inappropriate messages, helping exacerbate anxiety within populations. Many strategic errors in the opinion of professionals in the sector.
La communication de risque telle qu'elle est faite,
risk communication, as it is done, needs to be technically supported by experts. Not there are none in the country, but by experts, notably from WAHO, who are currently best equipped in the West African region to provide the support.
West Africaines sont les mieux outillées pour faire cet appui. Deuxièmement, la communication de risque a besoin.
Secondly, risk communication needs to be reduced to the intermediate peripheral level, according to the health pyramid of our country, because at these two levels, the communication undergoes the dictates, if not the proposals that are made at the central level.
Le dictat, sinon les propositions qui sont faites au niveau central.
Mais pour le moment, la communication que nous faisons.
For the moment, the communication we are making is not so much a well-developed risk communication. As in other countries, we are making a communication that exists only when an unusual phenomenon happens, a communication that we do when we are faced with the facts accomplished, whereas risk communication would like to be based on a preparation before, during and after.
C'est basé sur une préparation d'abord, avant, et pendant et après.
I've analyzed the communication that was carried out on Ebola during the epidemic in West Africa, and I highlighted a number of errors that were made in communication. The first error has been to focus a whole section of the communication on the supposed risk of transmission through hunting from animal to human, while those supposed risks do not correspond to a reality for several reasons. So having access to some of the risk communication coming from the animal is a mistake, and it diverted from the real problem, which was a man-to-man transmission that we should have concentrated on.
Hence, the UNDP and the WAHO, in collaboration with the WHO, found it useful to take stock of the state of risk communication by conducting an analysis of the regional context. This analysis, initiated by experts in recent months, has been combined with an initiative to strengthen the capacity of specialists in the countries of the region. It is in this context that Abuja, the federal capital of Nigeria, recently hosted a workshop on capacity building on risk communication in relation to epidemics and pandemics in the ECOWAS region.
On a là une forme de communication qui est simplement commençante.
Here we have a form of communication that is simply a debut in the region. Institutionally, we do not always have the structures in place to start this communication. The complexity comes from the fact that we are on a field that is accustomed to communication that is not that based on risk, and communication on risk goes beyond what we are doing for now. And unfortunately, we have not always have all the skills to make this kind of communication.
Toujours toutes les compétences pour faire ce genre de communication.
This analysis of the situation is still ongoing. You know, the risk communication is the sixth component of the international health regulation, and we have to recognize that our countries have not advanced sufficiently in this component. We are happy today, and there are many opportunities. The Assembly of African Heads of State has just devoted 0.5% of the budget of the entire African Union Commission to strengthen the implementation of the international health regulations, including the risk communication. These are all opportunities that are presented to us, and it is up to us actors, specialists in the field, to take stock of the strategies to guide health policymakers and strengthen the risk communication component in the field, strategies for preparing and responding to epidemics in our countries.
This workshop, which included the participation of epidemiological risk communication specialists and national epidemic management officials, is part of the implementation of the regional project supporting and strengthening post-Ebola regional medical surveillance and the socio-economic recovery initiatives in West Africa. This project, funded by the government of Japan to the tune of $4.5 million and coordinated by the UNDP regional office.
We think that for the Ebola specifically outbreak we think that the capacity building it's really important for these countries and also the information sharing. So we'd like to continue working on this area with the important partner, which is namely UNDP. We think this issue is important and this is our priority. And this is also mentioned in the Ticket 6 in Nairobi last year. So we are thinking really important for this to improve the capacity building. And so I'm very pleased to attend today's event.
Cet atelier s'inscrit dans le cadre de la mise en œuvre du projet régional d'appui aux pays qui.
This workshop is part of the implementation of the regional project to support countries that have been affected by the Ebola virus. And this is a very important activity in our annual work plan because during the crisis, we found out that the communication dimension was very important. That is why we wanted to organize this workshop here in Abuja, Nigeria, to bring together the communication experts from the 15 countries of ECOWAS to exchange lessons learned and good practice that we have collected during the Ebola crisis. I, as head of the support department of the West African Country Office, wanted to be present to draw on the experiences of other countries, to act as facilitator, support the implementation and collect good experience that we can share with the countries concerned.
Et à collecter les bonnes expériences qu'on pourrait partager avec le pays concerné.
The Post-Ebola Regional Project, which started in March 2016, has many achievements to its credit. These include the rehabilitation of health infrastructure, support for socio-economic rehabilitation of communities, training or strengthening of the human resources capacity of the 4 countries of the Mano River Union, Côte d'Ivoire, Liberia, Sierra Leone and Guinea.
En Côte d'Ivoire, par exemple, il y a eu la formation.
In Côte d'Ivoire, for example, there has been training of women on defense and security forces, awareness and behavior in areas that are as sensitive as the cross-border areas, where they were trained on behavior and awareness on epidemiological risk issues. We have the Mano River Union, the joint cross-border units for what they call the restoration of trust, that we will support because these joint units are between the common borders of the 4 countries that I mentioned and are at the forefront of strengthening social cohesion. In Liberia, there have been civil society structures and other national structures that have been used to carry out the same kind of activity. For example, there has been rehabilitation in about 600 villages since then, and also the construction of facilities to have drinking water. There has been the rehabilitation of health centers and police stations in Guinea, for example. Guinea was therefore focused on cross-border police and gendarmerie posts, but also on health infrastructures at the borders to enable the administration to have adequate infrastructures, and also to provide the populations with easy access to medical assistance in case of need. At the regional level, I was saying that we did a lot of capacity building workshops for the 15 members of ECOWAS.
Donc des 15 pays membres de la CEDEAO.
In terms of human resource capacity, the Abuja Meeting provided an opportunity for national, regional and international experts to share their experiences. Participants from the 15 ECOWAS countries were subjected to simulation exercises, practical exercises, presentations, debates and plenary sessions with reference to the framework of application of international health regulations, and this with the collaboration of various technical partners.
Here we've been working on building capacity, so training people to develop the communications on the ground, both the messages and the processes by which to deliver risk communications to the people in their community. Today we're conducting a tabletop exercise, which is where the participants have been given a scenario of a fictitious country in which an avian flu outbreak has taken place. So based on the scenario, each group is identifying tasks and developing messages associated with the tasks in the scenario. So for example, in this scenario, an avian flu outbreak has occurred, and so the participants are going to be developing messages about how to communicate with the community about the symptoms of the disease, the things that people can do to protect themselves, general messages. And many of these countries have experience already in outbreaks previously, and so they're bringing a lot of institutional knowledge to the table, and WHO is delighted to be here to support.
We technically supported the preparation of this workshop and participated in order to learn from other countries, to see what is happening in the region, what are the gaps, what are the expectations from partners, what does WHO intends to do to support the countries, because we accompany WHO in their support to the member states.
Donc, comme c'est vraiment un nouveau projet qui vient de démarrer, ça vient au bon moment.
It is a new project that has just begun. It comes at the right time, and I congratulate the WHO and his partners for this initiative, which seems to be a first in this format at the level of the sub-region, and with the capacity building, which is meant to be a data collection to enable us to have a basic situation where we can take notes and discuss with partners and know where the ECOWAS would like us to intervene in that sector.
Well, Noguchi, we do research into medical issues. Okay, so our results are very important in communicating the causes of the illness and the extent of the illness to the public. So what we do is to find out what are the causes of the diseases, the actual pathogens that are involved, and we communicate that to the Ministry of Health to help policy and operations.
These are better equipped specialists emerging from 4 days of capacity building, qualified to help their respective countries to raise awareness of infectious diseases and to devise, in times of crisis, strategies for communication and education of the population, adapted and capable of arousing the adherence and the commitment of communities.
Les acteurs, les participants ont compris.
The participants understood that it was necessary not to wait for the crisis to draw up communication plans, but to make risk communication plans based on those identified in the respective countries. The second lesson is in terms of community involvement. You know, we always use as health technicians, as health communications to give lessons. It is important today that the community can take ownership of our messages and be able to include them from the very beginning of the design process regarding our communication strategies.
It's very important to me personally because I am of the emergency response team of the ECOWAS Commission, and what we normally do is to be in the field to make sure we help member states who are confronted with emergencies all the time. So learning about risk communication is part of preparation, and it's a vital tool of which if you don't have it, part of the arm of response have been broken off. So we have learned a lot, and we are very happy to continue learning like this.
Risk communication is an integral part of the state of global participation in pandemics and epidemics. Its purpose is to ensure that anyone in danger can make decisions to minimize the effects of the threat and to put in place protective and preventive actions.